VSpann, America's communication network for veterans.
Welcome to the Veteran Special Programs American National Network. Today our VSpann spotlight is shining on an anxiety disorder that's not fully understood and often undertreated for our American veterans who are returning to civilian life. You're going to be gaining a better understanding of what this affliction is and what's being done about it today, as well as some new integrated approaches that can make a huge difference in helping our soldiers overcome potential psychological trauma. Dr. Frank Urasek is the chair of the Acupuncture and Oriental Medicine program at National University of Health Sciences and attending physician at the Stroger County Hospital Pain Clinic. Frank has been supervising a free post-traumatic stress disorder clinic at the National University for the last 2 years. Dr. Urasek, welcome to VSpann.
Thank you.
Frank, what is PTSD and what isn't it?
Well, it's pretty clear when you've got a veteran sitting in front of you what it is, particularly looking at his symptoms, looking at his history. There's definitely physical trauma to start with, which got him into the box in the first place. And this is a trauma that can go back. We've got veterans we're treating from World War II, so it can go back quite some time, that imprint from that trauma, that precipitating incident. So you've got that. Then you've got a whole series of sequelae that occur after that trauma, such as insomnia, anger control issues, isolating, pain, and any variation of these or combination of these.
And PTSD can begin right away or over a period of time, like you mentioned, for 30 years. I can describe a toothache. If I said I had a toothache, people would know what I'm talking about. When we say he or she has PTSD, people don't understand it.
There is the physical issue and there is the emotional issue. They kind of start together. The emotional issue kind of blooms at different rates for different people. There can be flashbacks. There can be things that remind the veteran of that trauma. If you read Doonesbury today, the comic strip, you see these two guys driving in or a man and a woman driving in a pickup, and something happens, and she says, "You're having a flashback now, aren't you?" And there's this big flash, and they're in a ditch. So it can happen at any time or be exacerbated at any time.
Now, post-traumatic stress disorder, the name is relatively new in medical science, but the symptoms have existed forever.
I'm sure.
Would it be safe to say that PTSD could be brought on by physical abuse, by sexual abuse, by something that happened to an individual early on, whether it's a child or an adult?
In our clinic, our free clinic at National, I do treat women who have been battered and abused, and sexually and physically abused. I do treat police officers who have witnessed a murder or one of their partners shot. So it incorporates a lot of different scenarios, yeah, absolutely.
Is it possible that folks who had been exposed to traumatic experiences came back into civilization and were misdiagnosed?
I'm sure. That happened a lot with the Vietnam vets. We really didn't get versed in this series of symptoms, of manifestations of this trauma until our veterans were coming back from Iraq and Afghanistan.
If I read the various journals and magazine articles, it appears as though we are ill-equipped to handle PTSD in our society at this point.
Well, we're overwhelmed. The Veterans Administration, Dr. Shinseki, who's the head of VA, came on public radio and announced, that we are way behind in our ability. We're trying to fix the problem, but in our ability to handle the load of veterans returning and the severity of their injuries. See, one of the things that's occurred is battlefield medicine has gotten so much better. So you've got survivors that you would not have had 10 years ago, 20 years ago, 30 years ago. When I was doing my work over at Bethesda Naval Hospital on Marine amputees, these guys were being flown in within a matter of weeks and days, amputees on life-sustaining meds and having horrible phantom pain. And I was using acupuncture and working with the docs with acupuncture points on the ear to help them not rely on meds. And this is the thing that is so interesting. I started out my career 25 years ago, and where I started it was in one of the largest drug and alcohol treatment centers in Illinois, working with addiction and addicts. And that's one of the serious problems with these veterans is addiction and alcoholism or dependence on drugs. So suddenly we've got another therapy that's natural with no side effects. They're not dependent, and it's a 5,000-year-old therapy. I'm talking about acupuncture and things like Tai Chi.
If an individual does feel that he or she is experiencing symptoms of PTSD, what could they expect as a normal course of action?
Well, they'd go to the vet. First of all, they'd be diagnosed by the VA, and that is an ongoing diagnosis. You got it. Here's what we're going to do. Talk therapy is not really that prevalent. It's too time-consuming. We're going to get you on meds. The meds have side effects, sometimes very bad side effects. So here they are. They've got all their symptoms. They've got some of the pain dulled. They're on psychotropics. They're depressed. They're suicidal. And nothing seems to be working. And they haven't gone through that deconditioning. It's not there. It's not part of the package, the deconditioning from the battle zone. So what do? Well, there's some things, like we're going to see later, that they can do to get help in that isolation, in that deconditioning, in that no answers kind of a box they're put in.
And it creates a kind of an endless loop. They get into a loop that sustains them in one direction, and it causes more stress, and I can see that as being an issue. Would it be safe to say that PTSD would be the diagnosis if the symptoms are over a period of time, say 3 weeks, a month, or something like that?
I don't think it works that way. I think once they're diagnosed early, coming off the battlefield, coming back from service, because it's become a pretty commonplace label in medicine. And now, okay, what are we going to do? And the interesting thing, the neat thing from my perspective, is there's a much more integrated approach now. Joe Chang has been doing acupuncture at Fort Bliss for years. He's written a book about it. It was published in China, in fact, about acupuncture and PTSD. The largest military hospital in the country, Rivers Army Medical Hospital, has been using for a few years. It's $1 billion facility using acupuncture for the treatment of burn victims. So we're seeing it. The key word here is integration. We're seeing this medicine, which has been around for 5,000 years, being integrated more and more into key areas to help to complement, to be adjunctive therapy for what's called mainstream medicine, drugs, surgery, psychotherapy, things like that.
Do you see more of an opportunity at this point for the medical community to embrace any kind of integrated medicine that you're speaking, as opposed to saying it's either my way or the highway?
I came into Stroger and talked with Dr. Torres, the chief clinician there, to pitch her on a PTSD clinic because I wanted more exposure. We had mostly Vietnam vets, a couple of World War II, a Korean vet. I wanted to be able to tap into the veterans from Iraq and Afghanistan. I thought that might be a good place. She said, sorry, we can't do that here. We got our hands full. However, we've been told by emergency medical services that chronic pain patients are damaged by a long-term opiate therapy we're looking for. So this is a doc talking to me, a Western doc talking to me, an Eastern doc, although I don't look it, saying that, so we want an alternative therapy in the place of our meds and our procedures. And the ironic thing is they're not really able to bill the therapy because insurance and Medicare, all that won't cover it. But the cost avoidance issues are incredible because we'll be cutting down on their major expenses, which are drugs and procedures using this alternative therapy.
Does this therapy, is this like a maintenance therapy? Or is it one session will fix the problem?
Never one.
How does the process work? In conventional medicine, you're under medications for a long period of time, and once you're on them, you have to remain on them probably for a long period of time. When it comes to alternative medicine or possibly integrated approaches, is that too continuing therapy?
Let me give you an example that happened about 3 weeks ago, Rich. I had a veteran who had stepped on a landmine and had shrapnel in his leg for 30 years. It started, and they had done surgery. They tried to get the leg as functioning as possible. So he had two issues. He had a pain issue going back 30 years that wasn't getting any better, that was being handled partially with drugs. And he had a function issue. So these are two big things, pain and function levels, that we can use for measuring efficacy. There's a technique where you can use points on the head for both pain, but even more importantly for function. Because if you can get, and it's a quick assessment, either it works or it doesn't work. So normally we see them once a week. I said to this fellow, because his condition was so severe, I said, look, I want to do, as outlandish as it may seem, I want to do scalp acupuncture for this issue to see if we can restore some function, and we'll look at pain as well. So I put the needle in the hip point on the head, and I had him walk. You do it right away. I had him walk. He walked down the hall, the corridor of our clinic over at National, and back. Significantly reduced pain, significantly restored function. First treatment. I said, I want to see you in 2 days. Came back, he said, I'm 75% better after one treatment, one needle. His wife was in the room. Neither of them could believe it. So he's had a couple of treatments. You reach a point where you're trying to clean up and get to those areas where you want to improve, but let's face it, 75% in one treatment ain't bad. And it varies, it all depends. I've had people at Stroger get up out of wheelchairs, leave their walkers. I worked the homecoming at Soldier Field. I had guys leaving their crutches and not needing their walkers after one treatment with, it's dim mak, which means poison hand therapy, where you hit the killing, paralyzing, and disabling points with 1, 3, or 5 fingers, because that's the medicine that's used in martial arts to restore your partner, so you got a practicing partner. So there are ways and secrets that nobody knows about until they see it or experience it themselves, or their wife finds out or their buddy finds out, my gosh, we didn't need drugs, we didn't need surgery. It's not for everyone. It's kind of a 20% get great results, 20% get no results, and then there's the other 60%, time will tell.
And it isn't voodoo.
Well, it comes, something 5,000 years ago. If you go to OTZI, O-T-Z-I, space acupuncture, you'll see a whole story of this that's 5,000 years old.
So that should not be discounted at all.
Correct.
The purpose of VSpann, of course, is certainly to make programs like this known to you so that you can make some wise choices. When we return, you're going to learn of one of the lesser-known integrated approaches to treating PTSD as well as traumatic brain injuries. Stick around, because this is VSpann.
VSpann is a network designed to serve the American veteran. Its mission is to inform, inspire, enlighten, honor, remember, and entertain. Soldiers and veterans will not ask for our help, but it needs to be given nevertheless. Winston Churchill once said, "Never in the field of human conflict was so much owed by so many to so few." This sentiment stands true today.
Veterans deserve this. We owe them, not the other way around.
It's time to pay back our debt to our soldiers and our veterans. It's time for VSpann.
VSpann, the Veterans Communications Network.
Our VSpann Spotlight is on treating our returning veterans who suffer from PTSD and traumatic brain injury in lesser-known integrated approaches. Pam Barnett, founder of Pause Assisting Wounded Warriors, is here to talk about what she does. It's a startup organization that's starting to take feet, no pun intended, to get pause now as the focus on using animals, and dogs specifically, to treat returning veterans who have PTSD. How did this come to be? You just didn't start an organization to help veterans. How did this come to be, Pam?
Well, about 3 years ago, I saw on the news this gentleman who is training post-traumatic stress disorder psychiatric service dogs for veterans with PTSD, and I remember saying, well, I could do that, but I really didn't have time. I was too busy working, and I didn't have another business. I had just sold my business, so I didn't have the facility. And then last year, my husband and I opened up a new facility, and we said, well, now we could, train a service dog for a vet, because we were just going to do one dog.
We all see service dogs helping disabled people, visually impaired people. And when we talk about PTSD service dogs, this isn't just buy an animal and now you've got a companion. There's a tremendous amount of training that goes into ready these dogs for service. Tell me what you do.
Well, the first thing we do is select a dog that is sound mentally and physically. We check their hips and their elbows, their eyes. They have to be sound, and they have to pass a few temperament tests in order to be qualified to enter our program. And we use rescue dogs or any dog that fits our program. And I start to train them, and then in about 3 months they're ready for a veteran. And then the veterans come. We pick the veteran who best is selected for that particular dog. They might not match, up with a certain dog, and then we have to pick a different dog or like that. And then we match them up, and then they take them home, and they come to me for training for 50 hours, more training, and then they pass a Canine Good Citizen test, and then they have to pass a public access test. So that's 30 hours more training. So it's 80 hours total once the veteran receives their dog. And then they have to recertify every year. And then we take care of those dogs for the rest of the dog's life with food, medical. Our organization leaves the veteran with no responsibility to take care of the dog.
Now, training for a dog for PTSD is much different, and the training can be up to 6 months in length. Mm-hmm. What are the elements of training that you employ?
The first thing that the veterans really need when they do come home, because they have like invisible wounds that people don't realize, they don't want to be around anyone. So they want to be away from people. They don't want to be with people. So these dogs make like a block and a buddy system with other people. So when we train our dogs, when somebody's approaching our veterans with their dogs, the dog is taught to stand in front of the dogs and block so that other person cannot come too close. And then our dogs touch or nudge the back end or the post behind the veteran to let them know somebody's coming up behind them. And they do like a buddy system where they watch their back. We teach them to clear, so when they go home at night, they can open the door and the dog goes into the home and make sure nobody's in there and comes back to the veteran, and then the veteran knows nobody's in that house. And then we teach them to we teach them to cover their body if they fall, whether that would be in a panic attack or when they physically fell, and they cover their body and protect them. We teach them to wake them up during a nightmare and turn on the lights. One of the most important tasks we've taught, and actually the dogs kind of taught us that, and we just gave it a name, is to lead me. Lead me would be lead me outside of a building or lead me anywhere I asked you to. So just take me, the leash, your arm, your clothing, and just take you somewhere. We taught them to do that on command because the veterans asked that. They wanted the dog to be able to take them out of a building if they had a panic attack, or if they were at a party and they wanted to nonchalantly leave the party, they just leave. But now with the dog, they have the excuse. They're like, oh, look, my dog's taking me out of here. Must have to go to the bathroom or something. So the dog is actually physically taking the veteran out.
Now, PTSD is an anxiety disorder, so how do you train a dog to recognize anxiety?
We really didn't train it, but it happened automatically by the chemical change in the person's body. When somebody gets upset, and I'm sure people know this who own dogs and love dogs, like when you have an argument with your kids or your spouse, the dog gets all upset and kind of comes in between you to, they know the energy has changed. And they become so close and such a partnership or a buddy system that these dogs pick it up just like a seizure dog would, who can recognize a seizure coming on and make the person sit down and be safe before the seizure happens. It's the chemical change in the body that the body gives off, and the dogs pick it up, just like the cancer dogs that can smell cancer. It's the chemical changing in the body.
In a few moments, we are going to be actually meeting a couple of these heroes of our heroes. And are there any breeds that stand out as better or more tuned to training?
Well, the breeds that stand out that are better for training are the ones that are the working line or the sporting line, the ones who really have high drives to work. Mm-hmm. Right now we have one Labrador in our group, and we have two Labradors and one German Shepherd. We have two veterans right now with dogs, because that's all I've been able to do. And now we have a new puppy, a 4-month-old lab puppy that we just acquired, and we'll take any dog that qualifies for our program. But there are certain breeds that we're working with. Yes, okay. The ones that are quickest learning and easiest to train, like Labradors, Golden Retrievers, German Shepherds, or any mix. I am not opposed to mixes at all, just as long as they qualify.
Do you have a set routine that is published for anyone in the country who chooses to get into this line of training, that you follow consistent standards?
Well, we have our own standards, and we haven't disclosed them yet, but we have our own, with our board of directors, we have posted our own standards of what our rules and regulations and what they have to go by. I don't really believe there's a standard, but I haven't been in contact with another organization, because they're now starting all over the United States, from East Coast to West.
Do you see that happening, Pam?
Yeah.
I would imagine with more starting up around the country that there needs to be more consistency.
I think there needs to be more consistency. That's why we contacted the one on the East Coast, so now we're working together. And she wants to get everybody working on one, but it's difficult because everybody trains differently. Mm-hmm. What somebody, trains differently than I do, I'll pick up on the things that I like with their training, but I won't use something if I'm not sure of it.
And then we're going to find out a little bit more about how do we get to learn more about organizations like PAWS. Now, when we come back, we're going to have a demonstration, and we're going to meet a couple of these one veteran and a up-and-comer. So stick around, because you're going to see this real-life demonstration and how this remarkable process is put to use. This is VSpann.
ICB works because it gives you the hands-on training you will need to take advantage of real-life opportunities. While I was a student here, I learned everything from radio production in the radio studios to video production and editing, and use those skills in my job now. I had an internship for 1 week with the PGA Tour Network on Sirius XM radio, and because of the things that I learned here, I was able to parlay that internship into a full-time job covering the PGA Tour. We produce live play-by-play from every PGA Tour event, and this job has taken me all over the country and to several others. Without the skills I learned here at the Illinois Center for Broadcasting, I would have never made it as far as I have.
VSpann, the American Veterans Communications Network.
This is the Veteran Special Programs American National Network. Our VSpann Spotlight today is on treating our returning veterans who suffer from PTSD and traumatic brain injury and lesser-known integrated approaches. And one of those is through the use of dogs that's starting to catch. And we have Pam Barrett along with us from PAWS. PAWS Assisting Wounded Warriors. And we have a little dog here that looks like a lab to me that is in training.
Yes.
Talk to us about Harold?
Harold Cole. We just acquired him last month. We just acquired him last month, so we've had him a month.
Okay.
And we're training him for a veteran.
Now, you told me that under the training guidelines, it's very important that only the handler handle the dog, not me or anybody else. And you don't know how hard it is not to go down and just go, ooh, love you, baby. But tell me what you do now that you've had Harold for approximately, what, a month or so?
Yeah, we've had him for almost 5 weeks.
Okay.
At the end
So
of
the first thing, you acquire the dog.
Somebody sponsored him.
Okay, and you've deemed that he is going to be one of the certified service dogs. Where do you start?
He passed the temperament test, and now we started training him from the moment we got him in like a military style. So he doesn't receive what a pet would receive, all that affection and playing and doing whatever he wants, whenever he wants, and going wherever he wants. As you could see, when he gets out, he's just so excited and so happy. He has a strict program, like a little boot camp for puppies. He's our first puppy.
What is the temperament?
The temperament test is we kind of touch their paws and little squeeze in between their toes to see what their initial reaction is. So if their first reaction is to bite, that wouldn't be the puppy we'd want. Okay. We want the calm one. That's what we want to start with.
Pam, would it be safe to say that if we were to zoom in on your feet, that foot wouldn't be one who didn't pass the temperament test?
Right, and it's because he dug a hole in the yard
okay.
that I kicked the hole when I was kicking the ball for the other dog and broke it.
So he passes the temperament test. Now we go into the training process. One of the things that was key that you just mentioned is that when you think of an animal that you purchase and you bring in as a pet that you're going to have for the rest of his life or her life, you integrate them into the family as a child.
Right.
You play with them and you give them. Not so with these dogs. Right. They miss out on all of that. Talk about the differences between service dogs and home pets.
It's not that they miss out on the love or anything. We don't want them to get attached to us and think that they're going to be part of our pack. We keep them, they get to interact with our pack, but they're kept separate. They sleep in kennels. They're housed in kennels when we go out. They're fed in kennels. They have to run strict guidelines on feeding and going out. They have to learn to go to the bathroom on command, which he does. And he learns he has to wait for the food bowl. He can't touch it till we say okay. And he learns, he knows a couple of commands right now, like sit, and he knows leave it. And we're teaching him lead me, like to lead me outside of a building at this early age. So it'll be instilled in him that would be the most important exercise that he could do for a veteran on command to get him out of wherever he is and hurry up.
And what process do you use to get that behavior attached to that command?
What we do is, like for the lead me, we just get him excited or, divvy him up and just get him really excited. And we put our arm or our hand in their mouth in the beginning because we want them to be able to not be afraid of taking your hand and not biting it, but taking you and leading you somewhere. And then we use clothing, and then we use the lead sometimes. Once they really know what lead me is, then we transfer it to an object. But in the beginning, we want them to know it's the human that they're taking and helping, not the object.
Now you did you showed me earlier putting a treat down and the discipline that Harold has in keeping that treat there until you said.
Until I go and get it.
Yes.
Right.
Yes. How do you do that?
What we do is we just teach them to leave it. So we'll throw it and we'll say, leave it. leave it, and then he learns if he sits, he gets it, excuse me, and then we pick up the treat and we give it to him. But he learns that he's not allowed to take anything off the floor. So when they are full access, public access service dogs, I'm sorry, when they're full access public service dogs, they're not allowed to react to anything in the public. They're not allowed to eat anything off the floor. You know, they'll be in restaurants or malls. They're not allowed to take anything ever unless they're sitting, and then their handler can maybe give it to them.
Now,
so,
according to what we talked about earlier, you have approximately 5 more months of training before Harold could be certified as a service dog.
Well, it could be certified for his public access, and then he has to be certified with his veteran. But since he's a puppy, it's going to take longer.
Okay.
It was the 2-year-olds that took 3 months with me, and then like 5 or 6 months with the veteran.
Okay.
But since he's brand new puppy, actually he's learning very quick.
Okay.
Extremely, and it's hard. You know, it's hard to teach him.
So now we're going to see one of the veterans, no pun intended, one of the veteran dogs here.
Yes.
So will Harold lead you?
Yes. Let's see if he'll lead me. He's really onto you, huh? It's all that affection talking.
I'm thinking I would love to. Oh, this is
maybe
tough.
he thinks you're going to be his new veteran.
Oh my! Well, I am a veteran.
So
but,
maybe you never know.
There you go. Okay,
so let's try
see.
it. Lead me. Lead me. Lead me. Lead me.
In any case, now we're not to mention the name of the animal because
you create too much excitement.
Okay, so not that we don't want to. So just for the benefit of anyone watching here, it's not because of lack of affection. It's because we want to maintain the discipline.
Right, and when he has his vest on.
And that he's working.
Right.
He's working.
He can't be distracted anyway. No way.
Okay. How old is Bill? Here, this is
Boulder.
Well,
it's okay, Bill Boulder. You don't care.
Well, I thought we're not supposed to mention his name.
Right. He just turned a year old in April.
Ah. Okay. Now, what we're seeing here is attention to you, waiting for the next level.
I'm going to give him a couple commands and show you.
Talk to us what we would expect now if you were the veteran.
Okay, so the basic is where we say side. So we get him on our side, and then that's where you could, go with him for a walk. That's where you always start, or the dog, when you're taking the dog anywhere into a building or just in general walking him. Okay, and then what we do, we teach that word block I told you about.
Yes.
So like if you were walking towards me, or even there, I would say block, and then he would stand in between me and you to give me my personal space, because it's the personal space that the veterans want. Nobody to get in their space, so they want their dog to block them. And then we teach them post. Well, they'll come up behind you and touch you if somebody's coming up behind. So we'll say post, and they touch. Did you see that?
Yes.
Oh.
Yes.
Sit. So wait. So like say you could just stay there, and then I'll just tell him the command. So I'll say post, and then he'll touch me in the back to let me know somebody's behind me. And then, so like if I was sitting down, and he would go forward, and then he would help me off my chair. And then if I was on the ground, I'd say brace, and he would help me up and give me the stability to get up back on. And I kind of need that when I get up sometimes off the ground. And then he doesn't do the lead me. I haven't taught him the lead me. He opens doors, he closes gates, he touches things. So I'll say touch, touch. Like if you hold out your hand, he'll touch. So when we say touch to turn on the light, he'll touch. So if you want to hold your hand out, touch, touch, good touch. You could even do it touch, good touch.
Yeah.
Then he just touches what button's going to give him the treat. But the touch is what teaches to turn on the lights. And he does cover. So like if, I don't want you to get on the ground or anything, but you'll get dog hair all over you. So like say somebody's laying on the ground, and you'll just give him the command, which would be your fist. You'll say cover, and then he'll cover, wait. and then he'll cover the body.
Now the process, Pam, when the animal is trained and ready for service, the matching of the veteran with the dog, what is the process that allows that to happen?
Okay, the veterans come to us, and then they work with the dog at our place way before they get the dog. So they already have been working with the dog.
Ah, okay.
And then, like, the first veteran didn't work very well with the Labrador we had. He really wanted a shepherd. So then that's how we raised funds to get him his shepherd, and then Chris came along, and then we got him his dog. And then, so like the next dog will just be matched up by the needs, you know, whatever the needs are. And then, like, for instance, that puppy and the future dogs we get, they have to do certain tasks, if they have physical as well as the psychological.
Do you know, Pam, if a viewer is interested in participating in a local organization similar to yours that's outside of the Palos area in Illinois, do you know any way that we can direct them to what to look for when searching for organizations like this?
Well, the best thing, like for our program, and I think with the other programs, they have to go through a PTSD program at the VA. And once they get their caseworker and the psychologist or psychiatrist to help them say that they need a PTSD dog, they have to first want it, and then they have to pass their program for PTSD. And then they can send them to us or other organizations in their area. Right now we're doing Illinois, of course, and we'll be continuing into Wisconsin.
Okay, your organization is PAWS, and if someone would want more information about PAWS in general, where do we go?
PAWSassistingwoundedwarriors.org.
Okay, very good. Well, thank you very much for being here. I appreciate you spending the time on VSpann, the Veteran Special Programs American National Network. We certainly want to thank you. And of course, we want to thank Dr. Yursek. He was here talking a little bit about the process of acupuncture relative to PTSD, post-traumatic stress. And of course, we want to thank all of our friends here at the Illinois Center for Broadcasting, which made this program possible. The Illinois Center for Broadcasting at the Lombard campus. We want to thank you for being here. It's the VSpann network, and we are here to make sure that you know exactly what it is you need to know in order to find what would help you as an American veteran. This is VSpann.